Legacy Foundation is Lake County's community foundation. For over 30 years, we've partnered with donors and nonprofits, focusing on youth development, the arts, the environment, health, literacy, and other causes that matter to you. We're committed to Lake County forever. First Things First Porter County is dedicated to supporting families, healthy beginnings, and quality early learning, ensuring every Porter County baby is born prepared for a strong start in life. Learn more at firstthingspc.org.
I have a very strong connection to other students. Everyone makes an effort to help each other. I'll remember the feeling of being here, the feeling that I was a part of a family.
Additional support for Building Blocks is provided generously by Tom Sorlis and Sue Eleuterio, as well as Porter County Community Foundation, serving Porter County since 1996.
Building Blocks, the podcast, is a co-production of Lakeshore Public Media and First Things First Porter County. For more information on Building Blocks, including this podcast, as well as the television show, visit lakeshorepublicmedia.org/buildingblocks.
Hi, I'm here today with Andrea Sherwin from Mental Health America of Northwest Indiana, and we're talking about her organization and its relationship with supporting families in our communities. Welcome, Andrea, to Building Blocks,
Thank you.
The podcast. Tell us a little bit about yourself and your organization.
Sure, thank you. First of all, it's a pleasure to be here with you this morning, as always. My name, as you said, Andrea Sherwin. I'm the president and CEO of Mental Health America of Northwest Indiana. We serve Lake and Porter County. We are an affiliate of Mental Health America National. We're proud to be affiliated with our national group, which I was just with at our national conference. And we are an agency that has served Northwest Indiana since 1957. A lot of people are surprised to hear we've been around that long. And since about the mid-90s, we have really had a focus. We have a unique focus on early intervention and prevention. We believe very much in the before stage 4 concept for both physical and mental health. We offer a full spectrum of programming, but about 80% of the work we do is with young families, parents with children, prenatal to age 5, making sure that we get them a good start until we are able to work with the schools and get them in the education process.
So critical. We know that there's this optimal time of development that happens before children enter the school arena. Tell us a little bit about those services that you do provide for families and children.
Absolutely. So as I said, about 80% of the work we do is in that early childhood space, early intervention and prevention. So we are the organization locally that brings, for Lake County, we have the Healthy Families Program. We do our Parents as Teachers program. And then we have a specialty offset of our Parents as Teachers program called ETAP, or Empowering Teens as Parents. And so all three of those programs comprise our home visiting services. We have a team of about 85 total employees. About 55 of those employees are working in homes with families. So I often tell visitors to our office, if you don't see anyone here, that means we're actually working, which is the opposite of what you would expect. But they come in and they dock and they get their materials for the day and they head out and they work with families in homes. And it's beautiful work. And because of all the work we've done in this area, we are one of the largest home visiting agencies in the state of Indiana, which we're really proud of. We serve anywhere from 600 to 700 families a year in home visiting. And that small team of employees actually completes about 15,000 home visits a year. So when people hear that number, that is really that point of understanding that we are deeply ingrained in the community and supporting families.
And that we know that home visiting is really one of the most effective ways to support families and really that meeting families where they are in their home environment.
Yes.
Describe to us what a home visit looks like.
Sure. So when we go in to visit with families, so really it starts in the hospital in a lot of cases. I mean, we do get referrals from the community. We get referrals from community partners. We have a team that actually goes out we have relationships with all the birthing hospitals in Northwest Indiana, and we're able to go in and work with the labor and delivery teams to say who's delivered overnight, who do we need to talk to, and we try to let moms and dads know right away, these are free services. These are no-cost services to you that we offer. We go in and offer infant safe sleep training, things that parents need to know right away, even before they bring baby home. And then what happens is there's an assessment. Parents are assessed based on, a number of criteria, and we learn a lot about the family. And the beauty of us having our Healthy Families and our Parents as Teachers program is there's an income requirement on Healthy Families, and so if they're unable to meet that requirement, we are able to still service them with home visiting through our Parents as Teachers program, which we're part of the national programs for that. And then the families are assessed based on their need, and so there's different levels of families. So typically a family will start out at level 1, which means you have a home visitor come into your home 4 times a month, once a week. That feels like a lot to a lot of people, but it's important that we do, and that we really do kind of I'm going to use the word intensive, and it doesn't feel like that in the home, but just really making sure that in the beginning, families really have the benefit of our support, education, empowerment. We are there to work with the target child, that's new in the home, but obviously as a result of that, work with any caretakers in the home, mom, dad, grandma, aunt, uncle. We have all sorts of families are made in a lot of different ways. If there are siblings in the home, there's some ancillary work we do with the family, with the siblings in the home. We do family goal planning. We take resources. We connect families to resources in the community, because obviously we don't have it all, but we know where to go because we have a lot of community partners. So up to and including things like our ETAP program, which is Empowering Teen Parents. We know that teen parenting exists, and we're actually able to go in and do some of those home visiting programs in the schools. We work through MOUs and or referral processes with the schools to go in and be introduced to teen parents, and offer them the same trainings and resources we would in the home. But we also, in that case, we are working to help them get to graduation. We know there's a high propensity for teen parents to drop out. So whether we're helping them go back and get their GED, or we're helping them get to high school graduation, and then college graduation, because we work with them on that too, and kind of prevent that second unplanned pregnancy, and just really get back on track for goals. So across the board, we're working with families on what are your goals, and in the process, we're also working to build those protective factors in the home, because in our work, we're working with some of the most vulnerable households in Northwest Indiana. So they're already facing a lot of challenges in the home, whether they're economic, socioeconomic, whatever's going on in the home. So a lot of times our home visitors will say, first we have to get through that layer, and then work with to be able to work with the child and the family. And so resources are a really important part of this, which is why working with you and working with all of the other collaborators, it's important that we all are in contact and able to refer people to different services.
So it sounds like, the home visitors, it's always about relationships. It's really about building those relationships, and it's building the relationships with those caregivers, whether that's mom, dad, grandma, teen parent, aunties and uncles, older siblings. It really is about the relationships. I want to go back to, you talked about assessing a family.
Yes.
And that can feel really scary.
It can.
Parents have a lot on their shoulders.
They do.
And what is the purpose of assessing a family, and what are some of the questions that a family might get asked?
Yeah, there's a lot of just background questions. There are some income questions, only because, like I said, there are certain programs that nationally have income, requirements, and then there are others that don't. And we're fortunate to have both versions, so we can fit a family no matter what we do. And both of the curriculums that we use for those programs are evidence-based, and so they inform each other as well. It's really about getting in and understanding the family family. What are some of their challenges? Simple questions, how many people are in your household? Things like that. Do you have a plan for baby? Is there space for baby? Is there a safe place for baby to sleep? Who all's in the household? Who's going to be taking care of baby during the day? And kind of understanding, just so we're learning. And really what I kind of view that as is kind of a trust building experience. If they're willing to start answering some of those questions because we know that they need the support and help, you're instantly creating a connection with that family. So when I first came on as CEO, I actually went on one of the shadows in the hospital because I was thinking about my own experience as a mom, and I didn't want anyone else. And there was already way too many people coming into the room, right? And so the approach that our team takes is such a warm and friendly, and we don't overstay our welcome in any way. If the family says, not right now, great, can we just leave this behind? And if you need us, call us, we're here for you. We're not trying to be intrusive in any way, but we have all these amazing services that help new families. And if you'd be interested, I can talk to you about it now. Or what we offer is when you get home from the hospital, let's set up a meeting then, and then we'll go into the home and do, kind of go through the questions. And what we're trying to determine is what's the best program fit for the family. So.
And I think the beautiful part about that is really your home visitors are professionals. They're trained.
Yes.
And they're non-judgmental. They're not there really to make decisions about a family's lifestyle or convince them to do something that isn't part of their values. So
absolutely,
that's really important with that trust.
Yeah. Mm-hmm. We really have a philosophy of education and empowerment. We're not there to run that family. We all have our own families to run in different ways. But it's really about empowerment. Let's give that family all the tools and education and information they need to succeed. And our goal is at some point those children and those families graduate from our program and they've learned so much. And I can tell you they have, because what's really exciting about our agency, we actually have professionals who work in our agency who are former clients of ours. Wonderful. Who've gone on to say, this is incredible work. It really helped my family. I want to do this. And then they went back for their education, and now they're in roles of leadership in our agency. And that in and of itself is one of the most rewarding things I find about MHA. That is a real testament to the power, again, of those relationships. I know our family had home visitors for several of our children. Yeah. And it was a very humbling experience because I thought, I know all these things. This is what I do for my career. But that little one comes into your home and it really it can turn everything upside down. Yes. And so they're in charge. They are in charge, and they're in charge 24/7. That's
so
right.
Having the support and having somebody come in and see your child through new eyes,
absolutely,
point out those points of strength, help your family be the very best that they can be is so incredible.
And one of the other things we do is, I'm going to use the word assessment again, but we'll do screenings in the home if we think maybe the child is presenting with a developmental delay. We have screening tools that we'll run with the family, and then we help them identify. We think, a child may need to be seen by general practitioner or maybe a specialty, and we've been able to work with families to identify those sorts of constraints. So a new baby in and of itself is challenging, and then if a new baby maybe with a developmental delay, or maybe they have a condition of some sort that maybe parent wasn't able to identify, and we help them identify that, get them the additional help they need. So, you start stacking on some of those things, and it's really important to have that trusted resource. And, our home visitors develop very strong relationships with their families. That is, in a lot of cases, that is the family's one trusted resource in some of our more vulnerable homes that they can count on.
So you mentioned Families Connect with Mental Health America and your programs, whether that's Parents as Teachers or Healthy Families or the teen parenting program, in the hospital sometimes. But what if that doesn't happen in the hospital? What are the other ways that families might connect with you?
Well, there's the old-fashioned way where they can absolutely just call us. So
it is old-fashioned.
It is old-fashioned, right? I'm showing my age. No, they can certainly call us. So we do receive referrals from different programs, like the WIC program, for example. We are a referral source for them. We have some relationships and we are a grantee of some of the state programs and funding. And so there's the My Healthy Baby initiative in Indiana, and we are a recipient of in our area referrals from there. But I always tell people, if you think you might need help or you just want to learn what it's about, give us a call. We'll send someone out to meet with you in your home, or you can come in, or however you want to do it. And sometimes, our team members will be out in the community socially, like with their families, and they'll meet someone and say, oh, you should hear about our program. You just had a baby. You should, and then they're like, come on in. We have free resources. And there's no, economically, we serve all sorts of households and all sorts of income levels. And so, people, I think I like that old-fashioned way where people can just pick up the phone and call us.
Imagine that. But I also know you do provide some services online. I understand that during the pandemic, you tested out some of the telehealth options that we have. Tell us about that and what has stuck and how you're adapting.
I think that was a great learning experience for a lot of organizations. I mean, it was very frightening when 80% of the work you do is in homes with families, and all of a sudden COVID, made its appearance, and you went, oh my gosh, how are we going to get this work done? Like, we're supposed to be in the home working. And fortunately, because we have so many field workers, we already had an infrastructure set up with remote laptops and access. And so we had sort of the basic foundation, and we said, okay, now we need to do this for real. So it was interesting, 2020 being the year of COVID, the core year, it was our best year ever because everyone got sent home. Everyone had their laptop. We were already set up, and they started doing home visits virtually. So for a while, this is fantastic. And then they weren't having to drive from house to house. So maybe instead of 4 a day, they were able to do 5 or 6 a day. And we're like, this is incredible. This is great. And then we thought, yeah, but we don't have eyes in the home. We don't see exactly what's going on in the home. And so it was interesting. I think a lot of businesses and organizations will tell that story of we had to send people home for a while, and then it was hard getting them all back. And it was because we had these experiences at home. We've learned a new way of working. But we were doing virtual story time with families. They could log in and look at that. We were doing all the home visits by Zoom. We all of a sudden had to get, a bunch of Zoom licenses. That just happens to be the software we use. People are using Teams and all sorts, and really learning that, like how do you make that connection across the screen, which can be a little bit harder. And then interestingly enough, when it was time to start calling people back in to go into the homes, I mean, we lost employees who said, I'm too scared. I figured out a different way to do this with my family's needs. And we did have some pushback to say, we were doing great virtually, and I remember saying, okay, but if we're on, I think I said in one of our Zoom meetings, I said, doesn't my home office look amazing behind me? And then if I turn this around, you can see the dirty laundry waiting to be done and the mess behind the camera. And I sort of said, it's kind of the same concept. We want to make sure we're really in the home 360 and doing that. But what's come out of that is the ability to pivot. For a family, COVID's still here. So if a family has an illness or they can't get out, maybe there's something going on at home, but they still want to keep their home visit. So we've actually been able to keep a portion of home visit flexibility where if there's a need, we'll still do the home visit virtually. And then as we worked with our national partners, so Healthy Families, Parents as Teachers, who kind of came in and then put, as you learn, you put new guidelines on things. And so right now it's kind of a 25% or less virtual, but it's still allowed. And so we've been able to build in some flexibility, and we went to a hybrid work environment. So it allowed everyone to still feel the benefit of some remote work, but also for us, culture is very important. So making sure we have a couple days in the office where we're all connecting.
Again, the theme of relationships comes through,
Yes.
and the building blocks and those that important foundational work that we do when we're
Absolutely.
together in space together.
Yep.
And it sounds like you really are very thoughtful about taking care of your home visitors. That's
try.
hard. That's hard work, right? Going into somebody's
Yeah.
home, it's not yours. Families do things differently.
Yes.
So talk about how you support those home visitors and the hard work that they do.
Yeah, I think there's a lot of ways we do. There's a lot of ways that as a community we can do better. I mean, I'll start with the financial piece. I always talk about it'd be nice to have a giant pool of money to really pay the people doing the jobs that some of us, maybe don't want to do. So that's always an interesting, point. But, ways we take care. Culture is very important to us. We have an everybody in the office on Wednesday day. So we have a chance to connect and be with each other. We have through some of our state contracts for home visiting, we have two clinicians on. We have a clinician on staff, and we have a contracted clinician who's basically like being on staff. We appreciate them both, and they're there to help our home visitors. They meet with them weekly to help them vet any emotional issues the family's having, any trouble they're having with breakthroughs. And so it's really a way for the clinician to help the home visitor help the family, and so they can bring some of their challenges there. Every home visitor has a supervisor that they also meet with once a week. They come in and have supervision, and the supervisors have a hefty reading job to do. They read through every case, and they look and they talk about what challenges are you having. Here's some ideas. They'll go out and shadow with them. They'll help, they'll go on visits to help them through, maybe there's a valley they have to get through. So they have a lot of support from their supervisors, from the clinical team, and I like to think from the executive team. Now, I'll send out my annual management survey in a month and we'll see, but and really, like, for us, even just being responsive to offering a hybrid work schedule. And one of the things that MHA, even before I was the CEO, was flexibility. We have to allow that flexibility for our home visitors so that if they all have their own families to also take care of. So making sure that we're helping them understand that some days are probably not the 9 to 5 day. And we understand that you have some other things to take care of. And it's about communication and staying in touch, checking in with your supervisor, making sure someone knows what your work plan is for the day. But also we want you to be able to take care of your family. One of the greatest things was MHA is always closed for 2 weeks at the end of the year, and it's something you rarely hear of anymore. But for those 2 weeks where most students are off school, and the agency identified a long time ago that most of our home visitors are young parents and they have children at home, and then they were worrying about daycare, and so we said, okay, we're going to close for those 2 weeks so you can be with your family. So for us, we're a very family-centric organization, not just our own employees, but the families we serve, and really trying to make sure that we're mirroring those opportunities for our clients and our staff.
That's so important, right,
Yeah.
to support those. I want to go back to something you mentioned earlier. One of the topics that you do educate about is safe sleep.
Yes.
Tell us why that's so important.
Yeah, it's really funny. Well, not funny, but it's interesting because if I asked you what you learned about how your infant should sleep safely, it's probably going to be different than what my family told me. If my grandparents were still here, they would tell me a completely different way. And the way you put baby to sleep has changed over the years. But over the last several years, there's been a significant effort at the state level for reducing infant mortality in Indiana. We have some of the higher infant mortality rates. We want babies to get to their first birthday and beyond, right? And so it was interesting because a number of years ago, the state said, well, you guys have access to a lot of the homes we're trying to talk to. We already have that trusted access. If we're able to fund some of these ancillary programs, can you take them in? And so we found that really benefited our family. So Infant Safe Sleep is a program that we do offer. And in a lot of cases, we talked about the assessments earlier. If we go into the hospital, we say, if you will sign up to do an assessment, we can do this Infant Safe Sleep training. And by the way, you get a free pack and play. So baby has a safe place to sleep for the first year of their life. It's really important. I think we all know that science and data and research changes over the years. And so now what we promote is the ABCs of safe sleep, alone on your back in a crib and nothing else in the crib. We're big on the halo sex. It's really important that we're creating safe environments for these babies to grow up in. And that includes, like back when I had children, it was all about the baby bunting and the mobiles and the stuffed animals, and none of that in the crib anymore, because we know we want to reduce those instances of, sudden infant death syndrome and all of that. And so we have partnered with the state to help reduce infant mortality as an extension of the work we do with families. So we offer that. We offer a smoke-free moms program where new moms, we're encouraging them to quit and stay quit from smoking for the benefit of baby. We have a mothers and babies postpartum depression group where we'll do screenings and then work with moms and create those social connections. So going back to really taking care of moms and babies, but also the whole household. I don't want to leave the dads out.
Of course not, right?
So, yeah.
So again, I don't think we can say it enough. It's ABCs of safe sleep.
Yes. ABCs, alone on their back in a crib and nothing else in the crib.
Nothing. And that's hard sometimes. I know families say, oh, here's this beautiful new blanket, all of that. But just leave it out of the crib.
Yep.
Display it elsewhere.
Exactly. And if someone needs a safe place for baby to sleep, get in touch with us. We can take them through the training. And if they need it, they'll get a free pack and play. And that allows cribette for babies to sleep in for the first year.
So critically important. So what are you most proud of in your work with Mental Health America in Northwest Indiana?
Oh my gosh. I think it changes every day. I think it really does. For me, coming in with my background being what it is, I'm a convert to that nonprofit side. I have a career in corporate. For me, it has been raising awareness about mental health, and so not just raising awareness about mental health in our community, but really helping people understand why our affiliate does the work that it does. For a lot of years, people are like, I don't understand what working with babies has to do with mental health, and so we've been able to educate and tell that story and consistently tell that story so that not only the community understands why we choose the programming we do, but our employees do too. We have orientation. Every new employee, I meet every new employee that comes in, and I tell them our why and why we choose that program, because I want them to be able to tell that story and why it's so important that we're working with families and children, because we are trying to really get into that early stage and make a difference. So I think understanding and continuing to help chisel away at that mental health stigma is something I'm really proud of. But honestly, on a day-to-day basis, I'm so proud of the work that the team does. I'm inspired by them. It's not just lip service. I just sit in awe sometimes when I hear the stories. We just had our big fundraiser event a couple weeks ago, and I was telling some of the stories. And one of the more recent ones was one of our home visitors working with a nonverbal child, and we do that. And it was a nice day, so she scheduled the home visit out in the community at a park, and she walked up, and the little boy turned and looked at her and said, "Why you at park?" That's all he said, but he spoke. So, again, building that trusted relationship, providing that support and empowerment to find the tools in the community that help that child get the care and the support he needed. Those are the stories. Those are the moments I'm so proud of my team, and they should be proud of themselves. They won't ever take a lot of the credit because they're the behind the scenes, but I always try to put a spotlight because they're the ones doing the hard work, and I'm really proud of that. I'm proud of them.
And they really deserve all that credit.
They do.
It's hard work, but it's such important work.
It is.
First things first, Porter County, we're really excited to support that work. We've just granted you a collaboration challenge grant.
Thank you.
Of course. Really excited to see you're partnering with the health department in Porter County and their fetal infant mortality review. Anything you want to share about that as we look to the future?
We are so excited. We moved into Porter County in 2019, and we've been looking for the opportunity. I've known you for a while. We've been collaborating. I've been fortunate to watch the unfolding of First Things First, and now to be able to be a recipient of that funding and to deepen our work and our commitment to healthy upbringings. Right? I think that's the most important thing. So we're very grateful, and we love to roll up our sleeves and get to work. So I appreciate it very much.
You're welcome. We're really thrilled to do that.
Thank you.
What else? What's on the horizon for Mental Health America?
It's funny, growth, right? So growth is a thing, and we hope to have more of it. So things that are on the horizon, something that came out of the pandemic is we, in the last couple of years, have introduced a new workplace wellness program. Because of my past career, I found that as the pandemic got going, I was getting a lot of calls about, my employees are acting funny now. They're crying at their desk. They're not coming back to work. I don't know what to do. Do you have a program? And we looked around to see what was available, and I said, give me a couple months. We're going to come back with a program. And now we have a really great program called Wellness Works, where we're able to go in, we do a survey, we assess the mental health of the workplace. I work with the owners, leaders, management team, and we're able to go in with some psychoeducational modules and work with employees to help them to kind of foster their mental health in the workplace. My legacy goal that I'm working on right now is, because we have such trusted access to homes in Northwest Indiana, we are working on clinical services, on counseling for our program families. So perinatal mental health for families. We're not there yet, but we've taken the first few steps and we're excited. We're moving forward. So it'll take a little time, but we're getting there. And that's where you're going to see some big growth and sort of a next level of career path opportunity with MHA as well.
Fantastic.
Yeah,
I
really excited.
Wish you all the best
Thank
with
you.
that. If people are interested in supporting Mental Health America, Northwest Indiana,
Sure.
or looking for your services, what can they do?
Yeah, absolutely. The traditional ways, they can certainly call us, as we talked about before, but our website is MHANWI.org. They can certainly go there. We also have some great free screening tools for mental health there that people could take advantage of. I encourage people to follow us on social. We're very active on our social media pages, so check us out on Facebook, LinkedIn, Instagram. We have a YouTube. See, I'm showing my age again. And we're on, I think it's called X now instead of Twitter, but the old Twitter. So see, my kids they'll be laughing at me if they see this or hear this. So yes, reach out on social, give us a call, send us an email. Visit us on the website. We would love to talk to you. And my big thing is we never overprescribe. If we don't have what you need, we'll get you to someone who does, because we have great community partners.
And that is the truth. Thank you so much for your work
Appreciate
and
your
for the
time.
conversation today.
Absolutely.
Yeah,
Thank
great.
you.
Thank you.
Legacy Foundation is Lake County's community foundation. For over 30 years, we've partnered with donors and nonprofits, focusing on youth development, the arts, the environment, health, literacy, and other causes that matter to you. We're committed to Lake County forever. First Things First Porter County is dedicated to supporting families, healthy beginnings, and quality early learning, ensuring every Porter County baby is born prepared for a strong start in life. Learn more at firstthingspc.org.
I have a very strong connection to other students. Everyone makes an effort to help each other. I'll remember the feeling of being here, the feeling that I was a part of a family.
Additional support for Building Blocks is provided generously by Tom Sorlis and Sue Eleuterio, as well as Porter County Community Foundation, serving Porter County since 1996.
Building Blocks, the podcast, is a co-production of Lakeshore Public Media and First Things First Porter County. For more information on Building Blocks, including this podcast, as well as the television show, visit lakeshorepublicmedia.org/buildingblocks.